tell them what they can charge, how much they can earn, and what their CEO salaries are. So I have to say, with all this hoo-ha about the public plan, I've long been tempted to ask Congress to put in the Swiss system and see how fast the insurance industry would embrace the public option instead of turning into a public utility. Boy, it's nice to have someone so knowledgeable. The next one too, Gil. Next is Jeff Verhoff, V-E-R-H, oh, Verhoff, V-E-R-H-O-F-F.
And then
I hear crickets. I hear crickets.
Then we'll hear from Roland Tolino of Chestnut Grove Square. Roland Tolino, but first Jeff Verhoff.
Here, Congressman, right here.
That's not,
right here.
That's not it.
Over here. Over here.
That's not him. That's not him.
Hey, Howard, will you tell him what left is?
Okay, I'm sorry. I didn't. There's a lot of people I just couldn't.
That's not him.
You should ask your helper.
That's not him.
Because you ducked the hard questions.
It's not him.
That's not him.
You said earlier that Medicare is being run by experts. Who are these people? This is a program that is $39 trillion in the red. These are experts. Who are these experts? Who?
Well, yeah.
Help from Howard. Help from Howard. I asked you to answer, okay. Congressman. You're my congressman. Howard Dean isn't my congressman.
Let's have a vote. All those in favor of getting rid of Medicare, raise your hand. All those in favor of getting rid of Medicare, raise your hand. All those in favor, hey, I don't see. All those in favor of getting rid of Medicare, raise their hand. Thank you. First of all, Medicare is not actually in the red because we don't use general funds. Now it is true that we are eventually going to run out of money sooner than Social Security because the cost of medical care is going up. But I don't know anyone over the age of 65 who wants to give up their Medicare, and the reality is that Medicare costs have gone up at a much slower rate than private insurance company costs, and Medicare uses 3% of the trust fund money for administrative costs, whereas in the private system, it's about 30%. So Medicare is operating it at a much less cost, and we need to figure out a way to pay for it in the long run, and this is one of the ways that we intend to do that.
Who are the experts?
Shut up!
The experts.
Shut up!
Shut up! He hasn't been called for. I'm just wondering.
There are federal employees who have spent their much, if not all, of their adult lives running Medicare, and the fact is they do a very good job. They're located in Baltimore, Maryland, and I'm proud that they work for the federal government. Roland Tolino.
That was the fair question. You told him to answer the question. He hasn't been called. He hasn't been called.
Come on, punch him out, Congressman. Punch him out.
That's not him. That's not him.
He's a constituent. Punch him out.
That's not him.
Give him what so. Punch him out, man.
Hey, tell your question. Go ahead. Do we have a microphone?
But he hasn't been called, right?
My question is...
He obviously wants to share a question with us. Please, Mr. Tolino.
There's $200 million that say...
No microphone. Give him a mic.
Mr. Tolino, let's get a microphone so everyone can hear you. It's not fair to when you don't have a microphone and other people have. So please share your thoughts with us.
There's $200 million over 10 years in savings if we had tort reform, and nobody loses but the lawyers. Why have we not even considered that tonight in the discussion, sir? Tell the American people that.
All right? This is the answer from a doctor and a politician. Here's why tort reform is not on the bill. When you go to pass a really enormous bill like that, the more stuff you put in it, the more enemies you make, right? And the reason that tort reform is not in the bill is because the people who wrote it did not want to take on the trial lawyers in addition to everybody else they were taking on. And that is the plain and simple truth. Now, that's the truth. Now, so, what is a reasonable possibility? First of all, I think most people who would agree, folks who get injured by doctors or hospitals ought to get something right. That's reasonable, right? Okay, now, secondly, I think what we don't want is a lot of lawsuits against doctors that are frivolous and creating the atmosphere in which we cause doctors to do more stuff than they need to in order to make sure that doesn't get brought up in front of a jury and so forth. So what I'm about to say is not authorized by anybody. I've tried it out on both doctors and lawyers, and neither one of them like it, so I'm sure it's probably somewhere a reasonable solution. But here's what I think we ought to do. It's not going to happen in this bill. This bill has enough enemies, as you know very well, because there's a fair number of them in this room. The more groups you take on, the more enemies you make, and we don't need any more for this bill right now. So here is a reasonable solution. And also, I might add, if we did put tort reform in the bill, my guess is we wouldn't get one single extra vote in the United States Senate or the United States House of Representatives. However, here's what I think ought to happen that I think is reasonable and fair to both injured patients and also physicians and hospitals and so forth and so on. You cannot take away a right to somebody to a jury trial. You can't. That's unconstitutional. It's not fair. However, what I think ought to happen, by the way, this is going to be a hot one. Ready? I think comparative effectiveness research is going to be a great help in reforming tort. How about that? And I'll tell you why. Because comparative effectiveness research is ultimately going to study what works and what doesn't, and it is going to create a national standard of practice. And a national standard of practice is an absolute defense in a court of law. If you've done the things that you're supposed to have done, then you cannot be sued. And any reasonable judge is going to say that. Now, here's what I think ought to happen. I think if you have an action that you're going to bring against a medical practitioner, it ought to go to arbitration. You cannot make arbitration binding, because if you do, you deny a jury trial. And then, so it goes to arbitration. If the patient is unsatisfied and believes they have still not been treated fairly, the fair thing to do is to have a trial and allow the arbitration verdict to be submitted as evidence.